Welcome to The Explainer. Today we've got a really exciting challenge ahead of us. We're going to take a dense 160-page doctoral dissertation and transform it into a totally user-friendly explainer that absolutely anyone can understand. The study we're looking at was authored by Dr. Rochelle Williams-Skinner, and it takes a hard look at exactly how telehealth impacted our military veterans during the COVID-19 pandemic. So let's dive right in and see how this incredible scholarly work translates into real-world insights about the future of healthcare.
To really understand why this study was so desperately needed, we kind of have to step onto the healthcare battlefield that many veterans face every day. Listen to this powerful quote from study participant P27. "The drive was killing me. Now I can talk to my doc from my living room." For so many veterans out there, just getting to the doctor, dealing with an awful commute, navigating physical disabilities, or driving in from out in the country is a massive physical barrier to getting care.
Before we get too deep into the academic side of things, let's just make sure we're all on the exact same page. What do we actually mean when we say telehealth? It's basically the remote delivery of healthcare services using electronic info and telecom tech. So, replacing that traditional waiting room and the in-person visit with a digital connection, whether that's a video call, a quick phone consultation, or even remote monitoring.
So here's our roadmap for today's explainer. First, the catalyst. Second, the investigation. Third, the hard data. Fourth, the human voices. Fifth, the everyday impact. And finally, a final question.
Part 1. The Catalyst. The Healthcare Battlefield.
Why did Dr. Williams-Skinner dedicate years to researching this? Well, it really comes down to the pre-pandemic reality. Think about it. A lot of veterans live in rural isolation, miles away from major medical centers. Plus, many are managing severe, service-related physical or mental disabilities that just make travel exhausting. And on top of that, there's a real cultural hurdle. The traditional military culture is often about, pushing through the pain and not asking for help until it's an absolute emergency. Add all that distance to VA facilities, and you've got a recipe for neglected health.
And then the world completely changed. The COVID-19 pandemic hit, and it forced an immediate, literally unprecedented shift to virtual care. Suddenly, a healthcare system that relied so heavily on in-person visits had to pivot overnight to protect its patients. But the big, pressing question was this. Was this sudden, forced shift actually working for our most vulnerable veterans, or was it just leaving them behind?
Section 2. The Investigation. Dr. Williams-Skinner's Study.
To find out if telehealth was a lifeline or a letdown, Dr. Williams-Skinner launched a highly rigorous scholarly research project. She used what academics call a mixed methods sequential explanatory design. Okay, let's translate that academic jargon, right? It basically means she didn't just look at a spreadsheet and she didn't just do interviews. She did both, in sequence. First, she looked at the hard quantitative numbers through surveys to figure out what was happening. Then she sat down and listened to the human stories to explain why it was happening. It's really the absolute best way to get the complete picture. Her investigation boiled down to two core research questions. Step 1. Is there a measurable statistical relationship between a veteran's satisfaction and their use of telehealth? And step 2, what are the actual on-the-ground factors influencing those perceptions? Is it the tech, the internet connection, the doctor's bedside manner over a screen?
Now, before we look at the results, we have to look at who actually participated because the demographics here are super interesting. A massive 85.7% of the respondents identified as female, and the study notes that roughly 85% of the participants identified as African American. So this gives us a highly specific, totally vital lens into how female and minority veterans experience this massive digital shift in care.
Section 3. The Data Speaks. Quantitative Findings.
Boom, 78%. This is a massive, powerful statistic pulled directly from the dissertation. 78% of the participants deemed telehealth highly advantageous for surmounting geographic obstacles. That is over 3/4 of the veterans looking at this new digital system and saying, yes, this solves my problem of getting to the doctor.
And to ground that quantitative data in real life, listen to this direct quote from participant P99. "I don't have to wait weeks or months for appointments anymore." I mean, wow. Telehealth didn't just cut out the awful commute, it radically increased the speed and efficiency of actually getting care.
But, a good explainer looks at all the data objectively. The study also found that 12% of participants actually expressed displeasure with telehealth, which is important. It proves that while this system is a huge success for the vast majority, it's absolutely not perfect for everyone. There's real friction there that needs to be addressed.
Ultimately, this statistical analysis proved a highly significant correlation. Easier access directly equals higher patient satisfaction.
It makes sense, right? When you remove that stressful barrier of a long commute, the crowded waiting room, having to take a whole day off work, a patient's overall experience just drastically improves.
Part 4. The Human Story, Qualitative Themes.
Now, this is where the research really shines, giving a true voice to the veterans. When analyzing all those interview transcripts, 4 major themes emerged. Theme 1 was convenience, just the absolute game changer of seeing a doc from home. Theme 2 was technology barriers. Think poor internet, glitchy apps, or just a lack of digital literacy. Theme 3 was the provider-patient relationship. Does the doctor still care if it's over a webcam? And Theme 4 was privacy and security. Folks having very real fears about data being hacked or not having a private room in a busy house to actually talk to their doctor.
A really great way to visualize these findings is the digital bridge metaphor. On one hand, telehealth is this incredible bridge. No travel, super fast access, linking vulnerable people directly to care. But, as that 12% showed us, there are missing planks on this bridge. If a veteran lacks tech literacy, or doesn't have high-speed broadband, or is terrified of a cybersecurity breach, they can't cross that bridge. Fixing those missing planks is the next great hurdle in healthcare.
Section 5. What this means for you. The everyday impact.
So you might be sitting there thinking, well, I'm not a veteran. How does this actually apply to me? The absolutely crucial point here is that by studying the VA's massive rollout of telehealth, we're looking at the blueprint for the entire future of healthcare. When telehealth works, it reduces the strain on your local clinics, which means shorter wait times when you actually do need to go in. It lowers overall healthcare costs for the whole system, and it highlights that as a society, we've got to invest in digital literacy support so that nobody gets left behind as medicine goes digital. Because solving this for veterans, it solves it for everyone.
Section 6. A New Standard of Care. Conclusion. By breaking down this dissertation, we really hope you've gained an appreciation for this incredibly dense scholarly work. I want to share the author's own words from her acknowledgments. She wrote, "This project is a testament not only to the resilience of military veterans, but also to the unwavering encouragement I received along the way." Dr. Williams-Skinner's work is just a beautiful reminder of the profound personal dedication that drives academic research, striving to guarantee equal, high-quality healthcare for those who've sacrificed so much. Her data proved beyond a doubt that telehealth is a massive lifeline. But let's bring it right back to your everyday life. I want to leave you with this final provocative question. If you had a serious health concern today, like right now, would you choose the traditional waiting room or would you fire up the webcam? Let us know your thoughts in the comments below. Thanks so much for joining us for this explainer, and we will see you next time.